It's a pleasure for me to invite our first speaker of today's session. And first speaker is Dr. K. Raghu, who would make his presentation on mind and consciousness. Dr. Raghu is an experienced psychiatrist with 21 years of experience in the field. He has been a practitioner and trainer of heartfulness meditation for a long time. He's also Mridangam Vidwan State first rank holder and trained in Carnatic music. He has completed his MBBS from Bangalore Medical College and received his Doctor of Medicine in Psychiatry from National Institute of Health and Neurosciences, NIMHANS, in 1990. It is an immense pleasure for me to invite Dr. Raghu for his presentation. Doctor, please give a round of applause to welcome Dr. Raghu.
Namaste to everyone. Before I start the session, just salutations to all our gurus and the divine being, and also for the organizers here for giving an opportunity to make this presentation today. So the topic that I've been asked to cover today is on mind and consciousness. So I just want to kind of give you an introduction why we chose this particular topic and what is it that we are actually trying to present. Now we do read a lot of things about consciousness from the metaphysical perspective, and then few attempts have been made on and off to bring this metaphysical concept of the consciousness into something of a use in daily life. Now I've been trained as a psychiatrist from NIMHANS, and I've been practicing meditation for the last nearly 25-30 years. A particular type of meditation called as heartfulness meditation. So this idea came about in 2014. Why not use meditation as a part of various mental health disorders? In our system, there is the concept of different trainers. So we call an individual to our place, sit with them, give them a half an hour of meditation session. This is how the system works. During the course of that particular sitting, when we do that with a patient or any individual, what we see is that over a period of time, they actually change in terms of their approach to life, their way of life. All those things started to be seen to be changing. So this was quite interesting. And when I actually read about the literature from our own mission, mental illness there, the broadest definition of mental illness was defined as a imbalanced state of mind, and a normal state of mind or a balanced state of mind is what was called as mental health or normal mental health. So if that is the case, a imbalanced state of mind can be brought into a more balanced state by using this technique of meditation. This was the first inkling. Now we have been continuing with this approach over the last 8 years. And with that approach, what we have seen is that most of the patients who have been treated with this meditation would require small dose of medication and would also require a shorter duration of treatment. So this was very, very interesting for us, and then we just continued with this particular process, and then now we have applied it to almost all the range of the mental illnesses, the whole range, except for these childhood disorders where there is a learning difficulty or mental retardation. We don't use the word mental retardation. We don't use the word mental retardation. So when we applied this, except for this particular category of patients, we have applied it to almost every other category, including schizophrenia, anxiety disorders, depression, bipolar disorder, almost every other case. So with this background, I will be presenting this particular topic to just highlight what happens if a person meditates regularly. Now I am not going to dwell into the many different types of meditation. There are nearly 250 types of meditation. So each one works differently, each one works at a different level. People combine everything, yoga, pranayama, meditation, everything as one bunch. No, you need to look at each of these things as a separate thing, because each of them work on a different kosha altogether. So with this background, I will start the presentation. So I covered this, the components of the mind. Normally, if you just look at the metaphysical literature, they talk about manas, buddhi, chitta, ahankar as the 4 aspects of the antakarana. But when we practice psychiatry, what we see is that we also see disorders of other aspects of the mind, which is the kalpana, bhavana, prajna and ichha shakti. Now there is a big debate going on whether the prajna is part of the mind or it is something different from the mind. But irrespective of the semantics, can we use it on a day-to-day basis for the empowerment of the patient? That's the whole point of discussion today. What happens? There are many things that changes during the course of the meditation. One of the things that we see as people regularly meditate is that the amount of thoughts and emotions, they get refined over a period of time. So the thought burden comes down, the emotions gradually convert into feeling. Then the buddhi, which is like more materialistic, gradually develops a discriminating quality. We call it as a viveka. So from buddhi you proceed on to viveka. Then there is a refinement of the imagination to the extent that as you go more nearer to the reality, what happens is that the imagination almost goes away, because imagination and reality cannot go together. Then the chitta, which is the, if you want to just look at it as consciousness, the consciousness gradually gets refined. Now refined of what? Refined of all the samskaras which are deposited in the consciousness. Now what we do during the process of the meditation is that we go on cleaning the consciousness of all the impressions that has been formed, whether it's in this life or any other life. But once it is cleaned, the person gradually moves from a conditioned state of mind into an unconditional state of mind. Now when the person moves into an unconditioned state of mind, that is what we call as a yogic mind, where the person has full sense of creativity. A materialistic person is under the control of the 3 gunas of nature. A yogic mind can control these 3 gunas. So this is the difference that you progress as you progress to higher realms of consciousness. Then the ahankar gets refined. Now there is, in our literature, when you read the metaphysical aspect of it, you just say presence of I or absence of I. But it doesn't occur in one stage. It's a very gradual process. In our system, we talk about 11 stages in which the ego gets refined. And the last one, as and when the ego gets refined, the willpower becomes heightened. Gradually, it multiplies it into a power called as divine will, where whatever that person wills will happen automatically. Now, most of you people are aware, so I'll just touch a word on this particular slide. There are 5 aspects of the health that we actually look at. Most of the people are only worried about the physical aspect of the health, but that's the last thing to be affected. The first thing to be affected is the spiritual, then the social, then the economical, then the mental, and last is the physical. And most of the people come to us doctors when the last part of the health is affected. Then again, people who are assembled here are quite aware of the different kind of koshas that is there, but very few people actually look at the kind of intervention that they do and in which kosha does it actually work on. So people do go to the gym, go to regular physical activity. Now that affects the annamaya kosha. People do pranayama, that affects the pranamaya kosha. If you do reiki, if you do pranic healing, if you do acupuncture, if you do acupressure, all of these affects the pranamaya kosha. Then you have other systems which work on the manomaya kosha. Now meditation, the path that we follow is called as Raja Yoga, modified Raja Yoga. So that works directly on the mind. Then you have the Vijnanamaya kosha, where you use that aspect of the mind for the spiritual progress. And the last one is the Anandamaya kosha, which is where you end up after covering all these things. Now, if you just look at the different dimensions of consciousness where the changes occur. So I've just listed a various, almost 17, 18 different types of consciousness where the changes occur in a 15-minute or half an hour session of meditation. Now, not many people are able to recognize all the changes that is occurring. because they are not very sensitive to the changes that is occurring inside. Now, I have not actually listed the biochemical changes, the genetic changes, all these changes I have not listed. I have only spoken about, from the point of view of the consciousness, what are the changes. So there is the sub and super consciousness expansion, expansion across the physical, mental and the spiritual realm, expansion of the consciousness across the 5 realms, then expansion of the consciousness across the 8 aspects of the mind I spoke about, internal and external expansion, body, mind, soul and divine consciousness, individual, cosmic, paracosmic and divine consciousness, finite and infinite consciousness, and across many different spiritual points. Now, these different spiritual points can vary depending on the system that you follow. Then the expansion also across the different chakras of the energy body. Expansion, once you start expanding into the super consciousness, then you have access to the different spiritual worlds. Then you have different densities of consciousness and witness versus observer consciousness and different stages of meditative consciousness. And the ultimate question is the consciousness the end of it? Because there are many aspects or many things, literature in our scriptures which says the consciousness is the highest. But in our system, we say that the consciousness is not the highest. You go through these different stages of consciousness, you then go into the seed of the consciousness, which is where it originates. Then you go into the next stage, which is the potentiality of the consciousness. Ultimately, consciousness dwells as a dimension of awareness when you go near the Bhuma. Now, I will just borrowed the word Bhuma from Chandogya Upanishad. So, there is a conversation between Naraka and Sananda. So, Sanaka and Narada, where Narada goes as a student to Sanaka. Then Sanaka explains all these steps. There are 26 levels in which he takes Sanaka to the highest, which is the self. There are only 2 things which are remaining. The ego is refined to such an extent that only identity remains. That's how we are able to communicate with the higher souls who are not in our realm as of now. And then there is awareness. It is through the awareness that they are able to communicate what they want to convey to us. So, identity and awareness are the 2 ultimate things which are left as you go near to the center or the God or the Bhuma. The terminology could be different. Now, in coming back to the topic on hand today, which is the relationship between mental health and spiritual journey. When we started training in psychiatry, we were told about many different conditions, which was very, very similar to what we had read in the metaphysical literature. So, we were totally confused whether it's a kind of a higher state of consciousness or it is an actually illness. So, over the years, this concept has actually got refined. What we have now come to an understanding is that the spiritual journey and the mental illness, they are actually progress in opposite directions. They are mirror images of one another. It is based on this concept that I am saying with confidence that if you use this particular meditation, even if the person has progressed in the wrong direction as far as the consciousness is concerned, we can bring them back to normal consciousness and then actually start making their journey towards the spiritual consciousness. So, if you just take home the point that the consciousness relating to mental illness and spiritual journey, they are both related to one another. They are in one continuum. One part of the journey you called as spiritual consciousness, other part of the journey you called as mental illness. When you are progressing along spiritual consciousness, your consciousness becomes more and more subtle. When you are progressing along mental illness, the consciousness becomes more and more concrete. In fact, if you want to just go by colloquial example, the first stage of any mental illness is when a person gets attached to one idea or one emotion much more than what they would normally do. Rather than getting it refined, you get attached to that idea, and the attachment, the idea it is attached to, that becomes grosser and grosser, bigger and bigger in the mind. Now, that is the first stage of illness of the mind. Now, how do we experience this refinement in the consciousness? If you suppose you go on doing meditation, how do you experience this refinement? There are 11 stages in which you can see the refinement of the consciousness occurring. The highest stage where we have to go as far as the spiritual journey is called as a state beyond the existence, non-existence. The next stage is called as the stage of existence. The third stage is called as stage of awareness. Then below that is the stage of attention, then concentration, then identification, attachment, strong likes and dislikes. The ninth stage is where we normally dwell, where we interact with people, we form samskaras within our system, and that get deposited in the different koshas. Now that is the ninth stage, samskara formation. The 10th stage, where the mind has lost its liquidity, is the stress. And if it goes beyond that into a more solid state, this is just like ice, water becoming ice. So that's what I just mean. The consciousness, which is more fluid in nature, now starts taking the form of ice cubes. And that is where the person starts feeling stressed out and they become indecisive. So there are so many other things that occur. The last one is the irreversible mental state. The reversible mental state is the illness of depression, anxiety, where they do get fully resolved. And the last stage, irreversible stage, is the stage of schizophrenia. Now, when you do meditation, there are 5 stages of refinement of the consciousness which can be felt by everybody, whoever does the meditation. The first stage is that you feel that you are totally lost, and unfortunately, many of the people think that feeling lost in meditation is the highest, and that confusion is there in many people. So, the first stage is that you are actually going to feel lost. You don't know where you are, you don't know what you are doing. Then in the next stage, you maintain certain degree of awareness. There is a degree of lightness that you can experience at the end of the meditation. That is because the samskara load is now gradually coming down. The third stage of refinement is when you can feel an attribute of the consciousness. Depending on which part of the journey you are in, at some places you can feel peaceful, at some places you feel more joy, at other places you will feel calmness or contentment. So different attributes of the consciousness can be felt at different stages. Then the fourth stage is the attribute also now disappears. There is only a stillness. You feel that nothing much is happening, but you are aware, but nothing much is happening. The last stage is where you feel everything, even that stillness is gone, you feel empty, that everything is gone. Now this is where most of the people, this is the fullness, stage of fullness, or the stage of nirvana, or the emptiness that Buddhists talk about, and the stage of fullness that the Vedanta talks about. Then how do we progress along this kind of consciousness? I mentioned about 11 stages of consciousness. How do we progress along those lines? It is nothing but intensification of the energy that you direct to. The more energy you direct to a particular thing, the more intensified it becomes, the more concrete the consciousness becomes. Now where is this energy coming from? This energy is infinite. It is there everywhere. Science also says there is infinite energy. You focus that energy onto something, and that makes that particular thing concrete. There is a saying that yad bhavam tad bhavati. So when you focus your energy on a particular bhava, that actually manifests. Now that is the bhavati that you are talking about. This is in terms of our region. In most of the literature, we only talk about the consciousness at an individual level and the cosmic consciousness, and that's where the journey ends. But as I said earlier on, the consciousness itself can be taken as to the highest, where it only remains as awareness. So in our system, that's where we gradually dwell into. There are 5-6 stages. Understanding from the chakra point of view, up to the 6th point, we call it as mukti. From the 6th point on to the Agna chakra, on to the Sahasradal, 7th chakra, we call that as the cosmic region. Then beyond that is the divine region. Beyond that is the ultimate, or the Bhuma region. Now, I'll just go through 1 or 2 aspects of where science is at. As far as, now this is in terms of the understanding based on experience. Is there anything that we do in terms of objectively measuring all these things? The main instrument that they have actually used is in terms of EEG. They have used EEG across many different types of meditation over the past many years now. And they have been able to notice that when a person meditates, they have bursts of deep sleep. Awareness is maintained, but the bursts of deep sleep is there, and they have the whole range of the waves that you see here, different levels of the waves. But generally, alpha and gamma seems to kind of predominate. But when they go into deep meditation, they go into this delta activity. So the reason why they actually have enhanced level of concentration outside the meditation, because people think that they have to meditate, concentrate during meditation. They don't need to concentrate during meditation. Concentration is an outcome of successful meditation. So this is the perspective where they have actually tried to relate the frequency of the waves that we see on the EEG onto the different learning aspects or the functioning of the brain. I don't want to dwell into that particular aspect now. Last slide, coming to what are the limitations in the current approach that we have got as far as studying consciousness is concerned. We rely on usage of instruments where you want the external to be projected. Whatever is happening internally needs to be projected outside. So you are relying on an instrument, and unfortunately we have not been able to get hold of an instrument which can actually successfully do that fully. So our ability to feel is lot more better than what the instruments can pick up. Second one is in terms of, I said there are 250 types of meditation. How do you replicate these studies? If you use different types of meditation, it should be replicable. The third one is there are multiple approaches to consciousness. I just mentioned about 18 dimensions of consciousness, and people can approach consciousness in any way that they want. Then how do you actually make it standardized? The fourth one is that each system works at different levels. I said 250 systems are there. In these 11 or 12 steps of consciousness that I gave, each system works at different level. Last one is the starting point of each of the subject is different as their baggage is different. So suppose all the people who are sitting here were to start meditation today, what will be the experience? Each one will experience a different state. Why is that you experience different state? Because you are all starting at a different point. The baggage that you got in this life in terms of your own education, in terms of family upbringing, in terms of the culture, religion, language, everything plays a role. So because of that, the experience will be totally different. So thank you very much for your patient listening. I'll be around. We will take question and answer session at the end of the session. Okay? Thank you very much.
Thanks a lot, Dr. Raghu, for your very thought-provoking and enlightening presentation. When I was going through the presentation of Dr. Raghu, who is well-trained psychiatrist, well-trained scholar in the research methodology of modern sciences, and when he made his presentation, so I was wondering that how deeply and closely Advaita Vedanta or Vedantic philosophy has influenced the modern understanding of the mind and its different processes. Like the way he talked, I was reminded of the Adi Bhautik and Adi Daivik and Adhyatmik, Sukh and Dukh. He was trying to understand the mind in the form of Pranamaya Kosh and Annamaya Kosh, again well elaborated by Adi Shankaracharya in his magnum opus Sharirak Bhasya. So it was a great presentation, Dr. Raghu.